Good evening, Zimbabwe. You are listening to Studio 7 from the Voice of America in Washington. This is Live Talk. I am Kip Stove.
And I'm Marvelous Mhlanga-Nyahuye this Monday, June the 14th, 2021, broadcasting from my home in Washington, D.C. due to the COVID-19 pandemic.
Tonight on Live Talk, we are talking about Zimbabwe's latest COVID-19 lockdown.
Vice President Constantino Chiwenga announced on Saturday that the government decided to ban most gatherings and other activities due to an alarming increase in the number of COVID-19 cases in the country.
The new regulations came into effect today, with some people welcoming the move, while others criticized the government, claiming that it was politically motivated.
Chiwenga announced that public transport operators should, with immediate effect, which is today, follow strict COVID-19 regulations, and all gatherings, including church services, music shows, and sports, have been banned. And funerals are expected to have a maximum of only 30 people.
According to Chiwenga, who is also the Minister of Health, all offices are supposed to decongest by 50%, except essential services. Businesses should operate from 8 a.m. to 6 p.m. under strict regulations, and beer halls and nightclubs remain closed. Bookstores should operate from 10 a.m. to 4 p.m. No drinking is permitted within or around bookstores.
And for food lovers, restaurants and fast food outlets are expected to serve takeaways only, and hotels have been urged to serve residents only. All markets are expected to close at 6 p.m.
According to the Ministry of Health, there were no COVID-19 deaths in Zimbabwe yesterday. The country recorded 117 new cases. At least 1,632 people have died of COVID-19 since March last year. Almost 40,000 people have tested positive for COVID-19 since March 2020.
And the Ministry of Health has also reported that nearly 700,000 people have received their first dose of the COVID-19 vaccine, which is now in its second phase, and 413,911 received their second dose. Zimbabwe used COVID-19 vaccines mainly sourced from China.
Yebo kambe linjani lapha likhona endaweni zonke zomhlaba ezijiyeneyo. Namhla-ke sigxile kudaba lwe-COVID-19. Siyabona ukuthi-ke sikhuluma namhlanje sokungene okuthiwa yi-COVID-19 lockdown. I-lockdown le yenzelwa ngokuthi ukhanyangazana kuyamemetheka umkhuhlane we-COVID-19 elizweni. Sikhuluma nje u-Vice President uConstantino Chiwenga wakubeka ukuthi akusamelanga ukuthi abantu benze imihlangano eminingi. Njalo nxa ekhuluma ngemihlangano leyi ukhuluma ngemihlangano njengokuthi liye ebholeni kumbe liye enkonzweni, uthi konke lokhu sokumele kuvalwe. So siyabona njalo-ke ukuthi kuningi okunye okumele kwenzakale. Sokumele ukuthi kule labantu abayi-30 kuphela okumele behambe emfeni. So nxa kuyuthi ingedlula-ke ifika leyo kungazani kungahlupha. So-ke kuphinde futhi kulabanye abantu abangani bakuchothoza labo besithi kungana kukhanye kuhle ngoba khanyangazani kulezombusazwe phakathi, ngoba abantu bese bekampena phela bephume phandle khonapha bezama ukudinga abantu abazavota ngo-2023. UChiwenga uphinde wakubeka sobala ukuthi nxa sokukhangelwe i-COVID-19 khona manje kumele ukuthi abantu emahofisini basuke kusale kuphela abayi-50%. Kutsho ukuthi nxa kulabantu 100 kuyasala 50. So nxa kule 50 kuyasala 25. So kutsho ukuthi sibili abafuni ukuthi umemetheke umkhuhlane lo emahofisini. Ngaphandle kwalapho-ke okuthiwa ngama-essential services. Lapha sikhuluma ngamasotsha, sikhuluma ngabantu be-health labanye abanjalo. Amabhizinisi sokumele ukuthi avulwe ngo-8 a.m. avalwe ngo-6 p.m. belandela i-COVID-19 isiqondiso. Kuzobuya-ke ama-beer hall, ama-night clubs, konke kunjalo kuvaliwe. Ama-box store lawo sokumele avule ngo-10 a.m. avale ngo-4 p.m. Njalo akula muntu ovunyelwa ukuthi anathe utshwala kuma-box stores lawo. Ama-restaurants laba-ke abanika abantu ukudla lokunye, lama-fast food outlets okunye okutshiyeneyo, sokumele ukuthi-ke banike abantu lokuthiwa ngama-takeaway. Emahoteleni akusavunyelwa ukuthi umuntu angene afike athathe-ke ukudla khona ngale kumbe athenge. Lamamakethe siyakwazi ukuthi kulembare, kule renkini namanye atshiyeneyo asevala ngo-6 p.m. Kuzobuya-ke nxa sesikhangela futhi-ke okwethulwe ngabezempilakahle, ugatsha lwe-Ministry of Health lolu luyabika ukuthi-ke izola kula muntu obulewe i-COVID-19 kodwa bayi-107 abantu abahlolwe batholakala belomkhuhlane lo. So-ke bayakhuluma lapho ukuthi umkhuhlane lo uyamemetheka sibile okunye okumangalisayo, kukhanya utshaya abantu okunzima. Abantu 1632 sebabulawa yi-COVID-19 kusukela ngoMbimbito nyakenye. Besekusithi-ke abafika phose 40,000 ngabantu sebahlolwa batholakala bele-COVID-19. Nxa sikhangela-ke ukuhlatshwa kwabantu, abantu sebehlatshiwe bafika 700,000 khonapho. Kube sokusithi-ke laba ngabantu abahlatshwe okokuqala, besekusithi abahlatshwe okwesibili bayi-413,911. So-ke kunjalo Marvelous.
Aiwa, kunavo vachangobva kupinda muchirongwa chedu cheLiveTalk nhasi nemusi wemuvhuro June 14, 2021. Tinokuchingamidzai nemufaro ipo pano pachirongwa chedu. Nhasi tichange tiri kuenderera mberi tichitarisa nyaya yedenda rechirwere cheCovid-19, tichitarisa zvakare kubayiwa kwenhomba. Tozotarisa zvakare kuti takaona isu mutevedzeri womutungamiri wenyika vaConstantino Chiwenga vachizivisa ivo panemusi wemugovera kuti lockdown yakudzokera zvakare. Vari kutaura ivo kuti pari zvino nenyaya yekuti uwandu hwevanhu vari kubatwa nedenda reCovid-19 hwati kwirei pari zvino, vakudzokera panzvimbo iya yavari kuti ivo pari zvino vanhu vanoita zvemitambo, kuvhurwa kwemabhawa, kuti vanhu zvakare vaende munzvimbo vachiungana kumachechi nezvimwewo zvanzi hazvichabvumirwa. Izvi zvinotevera mushure mekunge mutungamiri wenyika vaEmerson Mnangagwa vataura ivo svondo irori rapfuura kuti vanoita zvemitambo vaikwanisa kuita zvemitambo vaine vanhu vanosvika ivo 50 chete. Asi takazoona vachiwenga vachiuya vachitaura ivo kuti kwete, izvi vakanga vari kuti zvamiswa zvakare. Vemitambo vakaita senhabvu, mitambo yakaita secricket, tatoona kuti mumwe mutambo mukuru wanga uripo pakati peZimbabwe nechimwe chikwata chinobva kuSouth Africa checricket watombomiswa. Vari kutaura ivo kuti inyaya iyi iri kunetsa nekuti uwandu hwevanhu vari kubatwa ivo nedenda reCovid-19 huri kuramba huchikwira. Vataura zvakare vachiwenga nemusi wemugovera kuti vanoshanda mumahofisi vanofanira kunge vari pa50%, zvinoreva kuti vamwe vachange vari kushanda vari mumahofisi, vamwe vachishanda vari kumba sezvatiri kuita izvozvi isi tiri kuno kuAmerica. Vakataura zvakare kuti kana paine ndufu panobvumidzwa vanhu 30 chete kuti vange vari pandufu urwu. Vakataura kuti vanoita zvemabasa emabhawa hapana ari kubvumirwa iye kuti anwire pamabottle store kana mumabhawa. Vanhu vanogona kutenga doro ravo vachienda kunonwira kumba, asi mabhawa aya achavharwa kusati kwasviba. Vakataura zvakare kuti vemahotera havachabvumidzwi kuti vawanikwe ivo vachipa chikafu kune vanhu vanenge vari kubva kune dzimwe nzvimbo, asi kuti vanogona kungoshanda nevanhu vanenge vachigara pahotera ipapo senzira yekurwisa denda iri reCovid-19 ravanoti pari zvino rapfunya chisero munyika. Bazi rezveutano rinozivisa iro kuti pari zvino pane vanhu vanosvika ivo 1632 vashaya kubva kudenda iri reCovid-19 kubva denda iri ratanga muna March iro gore rapfuura. Uyezve vakataura ivo kuti pane vanhu vanosvika 40,000 vawanikwa ivo vachinzi vakabatwa nedenda iri reCovid-19. Vachitaura pamusoro pevanhu vabayiwa nhomba yeCovid-19 munyika, bazi rezveutano rinozivisa kuti pane vanhu 700,000 vawanikwa ivo vachibayiwa ivo nhomba yekutanga yeCovid-19 vari muphase 2 yechirongwa ichi. Vakataura kuti pane vanhu vabayiwa ivo second dose pane vanhu 413,911 vabayiwa nhomba iyi. Saka tange tiri kuzeya nyaya iyoyi nekuti vazhinji vanoita mabasa emaoko vari kushorawo zviri kuitika izvi, asi vanoitawo nyanzvi dzezveutano dziri kuti izvi zvinogona kubatsira mukuderera kwechirwere kana kupararira kwechirwere cheCovid-19. Gibbs.
Yes, I think we've got our first guest, and that is Mr. Sikumbuzo Mlalazi. He is in Britain, and they're planning to have a lockdown down there. So, but first of all, welcome to the program, Mr. Mlalazi.
Thank you, Mr. Dewey. How are you?
No, we're very fine. So, there are so many people who are saying, you know, this COVID-19 lockdown in Zimbabwe is just ridiculous, you know, because they're thinking that not every part of the country is actually recording, you know, high numbers of the disease. So what's your take on that?
Yes. Yet again, poor families will be hardest hit by the pandemic's long economic fallout, Mr. Jove. This means, people rely, in a country like Zimbabwe, everybody's an informal trader. So if this lockdown is coming back, it means a lot of families, especially poor families, are going to be affected. Hence the resistance. But then again, I've listened to the health expert explaining the consequences of the people not following the guidelines of the organizations like WHO. Zimbabwe especially, we are struggling with health facilities. So I think we need to think along those lines to say what's going to be the, imagine a country like Zimbabwe, the hospitals are overwhelmed already with other diseases, hunger and poverty. So I think as much as it is painful, I think it is necessary to have restrictions and people limited. I'm one of the people that do business in Zimbabwe, but I think, like I said, it is important to save lives. One life is lost, it can never be recovered. Babadu.
Thank you very much. Stay on the line. So we'll come back to you very shortly. So you can also mute your button. So I think we've got Dr. Simbi Soranga. Is here in USA. Marvelous. I think maybe he's still trying to fix his camera, but I think I can see that he's trying to join in. Dr. Langa, can you hear me?
Hi, Gibbs. I can hear you. I'm sorry.
Yeah, now we can see you.
Yes. So
Good location. I hope you can hear me.
Yes, we can. How are you?
I'm doing good. Thank you.
So there's this lockdown in Zimbabwe. What's your take on that? What's your take on it?
My take is that it should be driven by the science. What are the numbers saying? And I think the challenge is obviously communication hasn't been very good in terms of informing the population. I'm going to take out my mask for a second here, take off my mask.
Yeah, no, that's fine. Yes.
Yeah, so I think that...
you can face the other way around. Yeah.
The other way around. Okay.
Yes.
Okay.
Yeah, okay.
Thank you. It should be a little better now.
Yes.
So I think that any lockdown should be based on what is going on the ground. So from what I hear, the numbers seem to be going up in Zimbabwe. It's winter time and people are going to stay indoors. But I think the challenge has been that messaging from the government has been all over the place. So as long as we don't have enough people vaccinated effectively, this trend is going to continue. We do lockdown, we open up, we do lockdown, we open up. So I think the idea is what can we do so that we have a consistent, people can expect what's going to come next.
Marvelous.
Hey, mumboti tsanangura kuti munoona sei zviri kuitika munyika pari zvino. Tinoona kuti takamboona mutungamiri wenyika vamunangagwa vachitaura ivo kuti vemitambo vaigona kuenderera mberi nemitambo, vane vanhu 50 svondo rapfuura nemusi wechina ikoko, asi nemusi wemugovera vachiwenga vanova ivo mutevedzeri wavamunangagwa vakabudawo vachibva vataura kuti kwete, pari zvino vakutodzokera zvakare kulockdown iye yekuti zvemitambo zvambomiswa, zvekuti vanhu vaende kumabhawa zvambomiswa nezvimwewo. Zvinobatsira here kuti lockdown iitwe semaonero enyu?
Maonero angu Marvelous ndeyekuti lockdown inofana kuitwa based on my numbers ari kuitika on the ground. So it seems like my numbers ari kukwira in Zimbabwe. So it makes sense to have some kind of restrictions that are gonna minimize the spread. Asi chandiri concerned nacho ndechekuti hurumende is all over the place. Like you are saying, kuti President Varuti one thing today and tomorrow Ministry of Health is saying something else. It should always be driven by the science, which is the healthcare professionals should be telling the nation what's going on, and the government then comes up with policy based on what's going on the ground. So I think, my numbers can argue, we don't have a lot of other options. what I think should happen is we ramp up Nyaema vaccination, and meanwhile we find a way so that the country can still move forward while we contain the pandemic.
Toona zvakare kuti imo munomo muAmerica tiri kuona zvakare vanhu vazhinji vari kutora zvavo nhomba iyi yeCovid-19, but tiri kungoona vanhu vamwe vasina kutora nhomba. Muri kuonawo zviri kufamba sei munomo muAmerica muchikompeya nezvatiri kuona kuZimbabwe?
Yeah, I think he has got some challenges a bit with his network. We'll come back to him. He can move a little bit so that we can get him. Babu Mlalazi, so siyabona sibili ukuthi khonokho abanye abantu bakuchothoza ukuthi hayi akumelanga ukuthi ngakuyenziwa. So wena ubona ngazani kunceda ngani vele ukuthi kube labo lockdown labo?
Ngiyabonga babathu. Mina engikuzwisise kakhulu kwabudokotela and what I think is key in a pandemic era like this one. Funeka, like, I will start with you, Studio 7, because you are spreading information is very vital and important into our community, especially Minambuya, deep down the rural areas. In Makalangi, when I'm always home, radio receptions, they took the struggle to hear. In New Zimbabwe, you don't have electricity, television, so the information, and then again, language barriers. You know, you hear that it's Shona. So being programs, I always see some elections, for instance. People are here, you are there, you are spreading information. Why can't you use the same zeal? We start someone at this time to time, Studio 7 come in and maybe prioritize to engage people with other languages, so people can get the information, like catch up into an update from the government and the health professionals. This is the situation, and I'm a press as la head of the state. Told that information is vital. For instance, especially they are so obsessed who my political parties are. They want to listen to their leaders. They now prefer to love and listen to certain individuals than the country itself. So, if those leaders again come up and speak to the people to say this is a threat to every body, to the world, not to only one nation. So, abantu bagithi corona, yet there's information that can be spread around. Vaccine is another option. Vaccine. I speak from myself because I'm also one of the people that took that vaccine. So I think if vaccine now it's a proven science, COVID-19.
Oh yeah, thank you very much, and stay on the line. So I think our doctor is back. Let's go back to Dr. Ranga. Dr. Ranga, we can see you again.
Oh, so, thank you. I'm sorry, my
yes.
Apologies. My network here is pretty poor.
Yes. So you're saying that it is very necessary to have some of these lockdowns. So go ahead and tell us exactly how the government is going to prevent the spread of COVID-19 using these lockdowns that are coming once after after certain periods. Is it going to be workable to contain COVID-19 in Zimbabwe under these circumstances?
I think Gibbs, it should be a long-term kind of project, meaning that lockdowns alone are not the answer. But obviously, when you see spikes like we saw in Kwekwe, then it makes sense to say, how do we slow down the spread within that community? And lockdown may be part of the solution. However, I think that the government needs to be thinking more long-term if this is going to be going on for a year. Because we won't have enough people vaccinated. How can we manage as a country? How do we make sure that people can still, go to work, but at the same time minimizing the spread? I think that's what they need to be thinking about, because I doubt that we'll have enough people vaccinated in the next month or two, because we are running out of shortages of, we're running into shortages of vaccines. We need to widen the access to vaccines. We need to have more vaccines in the country. and we need to be moving quickly to vaccinate people. That's how we will overcome this.
Yes, but certainly vaccination is one of the solutions, but it's not the main solution, right?
It is the ultimate solution. So like if you see here in America, we have probably 65% of my adults, they have received at least one shot of the vaccines. And we see that life is returning to normal. And I can tell you in my hospitals here, the numbers have gone way, way down. So that life is returning to normal because most people are immune now to the virus. And that's what needs to happen in Zimbabwe too. I mean, there's no going around it because.
Oh, so I think he just fell off the radar. He may be coming very soon. Marvelous. Go ahead.
I can hear him. I think maybe. Can you hear us, Dr. Ranga?
I think something happened to him, so he's coming back.
Aiwa kutanga tiri kunzwa Dr. Ranga.
No problem.
Dr. Simbiso Ranga vari kutaura ivo vari kuno muno muAmerica vabva vadzoka. Saka Dr. Ranga zvii zvamungatsinhire kune vanhu panyaya iyoyi yekuti denda reCovid-19 iri ringawanikwe richidzikira sei? Nokuti tinoona vazhinji vanga vari kutaura kuti panguva yapfuura vanhu vaipfeka mamasiki, asi vazhinji munzvimbo dzavari kuenda vari kungoona vachiti vanopfeka masiki kana vaona mupurisa, uyezve vamwe havasi kunyatsonzwisisa nyaya iyi yekukosha kwenhomba yeCovid-19. Zvii zvamungataura panyaya iyoyi?
Zvandingataura Marvelous ndezvekuti kana vanhu vasati vavhaccinatwa vanofana kuramba vachiita mameasures aya atabvira tiri kutaura since last year, which means social distancing, kupfeka ma-face mask, kuavoid crowds. Even here in America, where most a good number of my adults have been vaccinated, they still say if you are not vaccinated, you want to minimize the risk. So unofana kuramba upfeka face mask, social distancing, and also get vaccinated as soon as possible once you have access to the vaccine. Saka ndozvandingakurudzira vanhu muZimbabwe. This is not about government, mapurisa, and so forth. It's about each and every Zimbabwean's health, and also the health of our loved ones. So until we have enough people vaccinated, unfortunately, we are going to keep going back and forth. And I hope that the government has a better strategy to make sure that people get vaccinated as quickly as possible. That's how life will return to normal.
If you had a chance to speak to the Zimbabwean government right now, from what you've learned here in the United States, what can they perhaps mimic that you've seen work here?
I mean, what I can encourage them, there's a good team, a healthcare professional like myself, we should be leading this cause. And the government obviously has to develop my policies based on what my healthcare professionals are recommending. A lot of Zimbabweans, when they talk to their doctors and their nurses, they will understand better why they need to be vaccinated. But when it's coming from politicians, sometimes the messaging is very bad, or it's all over the place. And people may think that, well, this is just being done for political reasons, or they don't know what they're doing. So one thing I would encourage in Ndezekuti, my healthcare bodies in Zimbabwe should be educating the public, for them to understand better what's going on in terms of how many people have been vaccinated, how many still need to be vaccinated, and why my lockdowns are very necessary at some point. They shouldn't just be one big stick. It should be based on my numbers on the ground, like they did Kukwekwe when the numbers went up a couple of weeks ago. The rest of the country was still functioning. But what I can say is the government should be communicating a message that until we have enough people vaccinated, we still have to take my precautions everywhere. Whether people go to my churches or my funerals, they still have to be thinking about COVID-19. So that messaging is going to be very difficult. I think what we are seeing is my numbers, they go up, then we come up with a policy overnight to say, let's do my lockdowns. They are necessary, but if they are not communicated well, we won't have my good results.
Mm-hmm.
And it seems as if maybe the government is not aware that there are congestions in buses. There's this Zoop called transport. I mean,
right.
As far as you're concerned, How far can COVID spread in a place like that where people are congested?
That's like a super spreader event, you know. So whenever you have people gathered, whether in Muma Zupko or whether Muma office, vastly vaccinated, personal social distancing, and sometimes people not wearing face masks and the like, it means that those are potential areas for spread for COVID-19. And that's going to be true whether it's Zupko, whether it's Kombi, whether long distance. So that's what we need to be thinking about as a country. If we're going to be doing those activities, how do we do them safely?
So now, if you had to communicate a message to Zimbabwe about the way they are treating transport, handling transport,
Yeah.
how best can they do it? Because maybe that's where there's a problem.
And that's a big problem, Gibbs, because people are still trying to go to work, try to make a living. So in the process of doing that, they are taking a big risk as far as getting the virus is concerned. So as long as tisatanya control the virus, kukwira magbazi and being in all these crowded places means that people are at increased risk under the virus. So what I would say is it's a tough problem. Of course, if you had private transport by yourself or your family, that would be okay. But as long as you're going out there, meeting other people who are not members of your household, the risk for COVID spreading is very high.
Thank you very much, Talk, and hold on there, Dr. Ranga.
Sure.
Let's bring in Mr. Musani Musontini. Mr. Ntini, welcome to the program, sir. Mr. Musani Ntini, welcome to the program. Can you hear me? I think you're muted, sir.
I can hear you now, Mr. Due.
Yes, yeah, very fine. So now, you see in Zimbabwe right now, kule COVID-19 lockdown. Ngesindebele sibili nxa ungakhuluma ngakho lokhu ungakubeka usithini khonokho kwe-COVID-19 lockdown kule Zimbabwe.
Mina ngombono wami mbonani ama-lockdown ewodwa awancedi lutho. I-lockdown ifuna nxa ule-target yokuthi uyakwazi ukuthi kulabantu abangabo ofuna ukuthi bethole ama-vaccine. Ngwakhala eZimbabwe, I think as of last week, bekule less than 4% of abantu asebethole ama-vaccination. So ungavalela abantu konke okufunayo, ungavala amabhizinisi and everything else. Kodwa nxa kuyikuthi i-pace yokuvaccinate abantu is slower than i-pace ye-corona that affect abantu, asoze kuncede. So I think udokotela ukhulume kuhle ukuthi iqiniso ukuthi ama-vaccine into eqakathekileyo okwenza nxa ukuthi uzagula ube exposed to i-corona, at least ule protection nge-vaccine. I-vaccine kayelaphi, kodwa yona itsho ukuthi hayi ungathola i-corona eyiyo, uyabe uvele umzimba wakho uyabe usujayele igciwane leli, kuzawenza ukuthi ungagula ube lokungama-flu symptoms okulutshwana, but akusoze kudinge ukuthi uye ku-ICU, akusoze kudinge ukuthi ugcine usadinga ama-oxygen. Kodwa iqiniso ukuthi kumele i-government yethu iqakathekise ukuthi iphe abantu ama-vaccine. Vani kukhulunywa nje bekhuluma ukuthi sebethole amanye ama-vaccine, i-procurement yama-vaccine, betshela abantu njalo bekhuthaza abantu ukuthi behambe beyethola ama-vaccine. Vani kuqakathekile endaweni ibhizinesi ivulekile ngoba abantu bavulile, azange ukuthi abantu behlale ekhaya, ba-reduce ama-hours. Abantu bayagcwala emabhasini ayezukho. Ungakhalela amazwe anjengako-America, eCanada le-Europe, ibhasi iyasebenza kodwa ayisebenzi i-full capacity. Ibhasi ethwala abantu abangu-50, amanye ama-seat vele abevaliwe kumbe ekhitshiwe ebhasini, kukwanisa ukuhlala kuphela engxenye abantu abangu-25 or even less. So kuyatshengisa ukuthi ekhaya nxa ukuthi abantu bezangena ebhasini njengamajodo, kumbe abantu azinkomo eziye edibheni kumbe eziyathengiswa, kulapho okuzaba yi-super spreader khona njengoba udokotela etshilo. Njalo siyabona ukuthi kwesinye isikhathi ama-election ama-campaign ayenzakala, so kunzima ukuthi i-lockdown leyi siyizwisise ukuthi kanti vele i-lockdown enjani. Kukhaya abantu nje hayi they are freely meeting bedlula linumber ekhulunywe ye-50 kumbe engaki. So unganthiwa into yakhona ekhaya I think kulobuzima obukhulu, but into eqakathekileyo yi-vaccine. I-government kayitshela abantu ukuthi iplani kuyini ukuthi i-14 million yabantu ekhaya bethole ama-vaccine. Asingakhulumi ngama-donation avele eChina kumbe evele eRussia, asikhulume ngokuthi umthuli uthi sikule surplus. Kasithatheni i-surplus lana sithi hayi sesimelele ukuthi i-Sinopharm eChina idilivele ama-vaccine afika 28 million. Sesibabhadile esikumeleleyo ukuthi bedilive, ayikhona lokhu esikubonayo. I-lockdown singavalelwa ezindlini ilanga lonke umnyaka wonke, kodwa nxa singavasinethwanga siyabuyela ku-square one.
Yes, cela ukuthi ufake sikhiwa nje briefly khonokho okade ukutsho.
I think what I was saying really in short was that the government should prioritize the procurement of vaccines. We know that we have over 14 million Zimbabweans that need to be vaccinated. Yes, they talk about the 80% herd immunity would put us at 10 million people. But even that, we are talking about 20 million doses. I don't think Zimbabwe up to date has acquired or received donations of more than 2 million vaccines in total. I could be wrong on the number, but we are so behind in terms of procurement. We don't have a sound plan on how we're going to address the required vaccines. So I think that should be top priority. Lockdowns, on themselves, they do not work, because you're going to lock down people for a week. The day that they go out, they'll be exposed to the virus. So I think if we can push more the issue of getting more vaccines, get people inoculated, so that when they get exposed, they won't end up in an ICU. They can just get sick and keep walking. That's what the government should be concentrating on over the lockdowns, because when it comes to lockdowns, some people think it could be a political gimmick. These are games. But if the government talks about lockdowns and also talks about the vaccines, how many vaccines are we getting next week, so that every person who wants to get vaccinated can easily have access to these vaccines. I mean, we understand that there's competition out there for these vaccines, but we need to make sure that we have a plan, we have the financial backing to say, as soon as Sinopharm can avail 10 million vaccines, we have the money to take care of it.
Marvelous.
Pane zvamataura nyaya yekuti masuper spreader aya chii, nekuti tinoona fanike mazuva aya apfuura tanga tiri kuona pane vanenge vachizviti mbinga kana kuti vari kuitawo zvimwewo zvavari kuita munyika, vari kufamba kunzvimbo dzakawanda wanda asi vachiteerwa nevanhu vakawanda, vachiwanikwa vachimhoresana, vachiita zvakawanda pasina anenge akapfeka mamasiki. Masuper spreader chii?
Zvandingataura Marvelous, masuper spreader, it just means vanhu vaungana pasina ma-proper precautions, vari a sizable number. So if you have 6-7 people very crammed in one vehicle, and there's one person there and a virus, it means that that event can easily turn into a super spreader event, because that one person actually is spreader to all these 6-7 people, and then the 6-7 people will end up spreader to their families, and then anybody they come across. So that's gonna happen faster, as opposed to, let's say, Munwanane the virus, but they avoid my crowds. They may meet with 1 or 2 people, spread it to 1 or 2 people. That would not be a super spreader event. So my super spreader events, my gatherings, where there are not enough precautions to minimize the spread of the virus, whether makombi, whether kumabasa, whether kuma church or kuma funeral. That's how that happens.
Saka chii chamungayambire veruzhinji kuti vaite kuitira kuti vasazopinde panjodzi iyoyi yekunge vari pamiunganidzwa inozoita super spreader?
Chandingakurudzira Marvelous ndechekuti unless any travel is vital, which means things like my funerals, which you can't avoid, then let's try to avoid my travel. Let's try to avoid my large gatherings, like my church gatherings, my weddings, things like that. I know it's a big inconvenience to everybody when that happens, but that's one way of minimizing the spread. And then when we travel or whatever, when we come across people, tunofana act like those people, we may have the virus and the people we're meeting may have the virus. So if we're going to interact, how do we interact properly? No, but not our social distancing, my face mask, basic hygiene. Very basic things that we have been talking about for the last year. I know people get tired, right? We have been doing this for a year or so. But unfortunately, unless enough people are vaccinated, it's going to be a problem. And the other thing I would say is, of course, if you have access to the vaccine, please go ahead and get vaccinated as soon as possible.
Yes, okay, go ahead.
The last one on the COVID vaccine. Panyayo inomba ye-COVID-19 taiona kekutanga vanhu vaimbotya, asi chii chamungavapewo yatingati simbiso yekuti kubayiwa nhomba kwakakosha sei kuti munhu abayiwe nhomba ye-COVID-19?
Chandingataura Marvelous, I can just give my anecdotal reports. Kuno kuAmerica, we know takatanga kuvaccinata vanhu vemuma-nursing homes nevanhu vanoshanda muzvipatara. What I have witnessed since January, I think I have taken care of almost like 0 patients from my nursing homes who are COVID because they have been effectively vaccinated. And we will notice kuti machiremba, almost everybody is vaccinated and access. So it means that my fears, they are not very founded. And we know my side effects, like for any other drugs, are for a COVID-19 vaccine. But we know a little bit about them, like my blood clots, my allergies, but all those are things that we can manage. Compared to risk, it might end very badly. So I would encourage people to get vaccinated, and that's how life is going to get back to normal. Like kuno ku America, takwenda ma supermarket and so forth, we don't have to wear my face mask now. That's a progress, and the same can be true in Zimbabwe.
Now, Dr. Langa, there are issues like people actually watching a lot of videos and reading a lot of material on the internet concerning these vaccines. So some of them are Zimbabweans, based in Zimbabwe. And I had a chat with some of them who were saying that, these vaccines are dangerous. These vaccines can lead to certain, serious effects, So how do you assure a nation like Zimbabwe to say, you know what, these vaccines are okay, use them?
What I would say is part of it is the proof is in the pudding, right? So far we have vaccinated, like here in America, probably more than 350 million shots have been given so far. And if you look at my numbers, okay, how many people have had my allergic reactions? How many people have had my blood clots? Those are the minority. And we're talking of millions of shots being administered. So based on what we have seen so far since December, when we started vaccinating people here in America, the numbers in terms of my side effects are very little. Then there are things that people just talk about that are not based on science. Things like infertility. I know people talk about tracking and things like that. That are just, there's no way we are going to prove to people one way or the other. Because it's just things that people are throwing out there. Unfortunately, that's not very helpful. I think that for those people, I would encourage them to talk to their doctors. If you have any questions, go ask your doctor what everything means. Because you still have to rely on your doctor for treatment of diabetes, high blood pressure, things like that. So if your doctor tells you like the vaccine is dangerous, maybe listen. But I think most doctors would say, hey, this is the way to go.
Thank you very much, and stay on the line,
Thank you.
Dr. Ranga. So let's have Mr. Skumbuzo Mlalazi. Mr. Mlalazi, nxa sikhangela sibili siyabona ukuthi abanye abantu bayayisaba ijekiseni leZimbabwe kungani kunjalo. Bayayisaba ijekiseni yokuvikela umuntu ku-COVID-19. So wena ngomunye wabantu abahlatshwayo, so akubatshela abantu ukuthi ijekiseni leyi ime njani emzimbeni womuntu.
Yeah, ngiyabonga Mr. Dube. Into enkulu kakhulu into ekhulunywa ngobaba udokotela. I just want to thank him so much because he mentioned ukuthi kunama super spreader. Then bubbles your mind ukuthi if you look at a country like Zimbabwe, there are places like ukuthi overcrowded, poor quality housing in densely populated areas, and I think they aid more to risk a super spreader. So I think the government should be concentrating in areas like that, Ombari and stuff like that. Because abantu abaningi abahlala emakhaya. Again, if you get information from umuntu ofana udokotela like this, spread that information to the people. Abantu aba vulnerable and abantu aba really need help from this pandemic. Because if you bring in a lot of people will be talking about politics, why is government doing this? And they don't bring in our options. Then that is the thing that makes our people suspicious of these vaccines because they want to listen to people that they trust. So if you bring in a doctor, someone who will explain to the people, then you go vastly aligned to anything. Kulumanje is an expert. These vaccines are useful and they have proven to the world, and they are being administered well. And it also sees about bagit. I mean, if you say I've taken a Pfizer 2 shots. I think I'm going to the 4th month now in Tatile. So I think working who health sector now, I've seen a significant improvement. Abantu they're not getting sick, even though our cases can be saying abantu they are testing positive. But for them getting ill and for them going to be admitted into hospitals because of the COVID illnesses, it is significantly reduced. So I think abantu abanama pre-existing illnesses again in our communities, they are the ones that health professionals should be concentrating. Like the doctor has been saying, hypertension or diabetes or HIV, for instance, those people should be visited and be explained by doctors, not politicians. Not people will be talking for a party on a party position. Politics at this junction, maybe people should be resisting such people because they really this is a threat to anyone. I've been listening to our leaders from the oldest 7 countries. They were meeting incentives in UK. They promised will be distributing millions of vaccines to our people. But if there's no message sent to our people and politicians are still pulling opposite directions to each other, then we are going to have people resisting those vaccines. And then we are going to have a Africa which is not vaccinated and which is not going to be helpful for our people.
Thank you very much. Let's bring in Dr. Ranga. Marvelous, go ahead.
Ndatoda kuvunza kuti Dr. Ranga tinoona pane mamwe mavhaccine ane madhosi maviri. Munhu akatora dhosi rimwe chete orega kutora rechipiri zvinofamba sei?
Zvandingataura Marvelous ndezvekuti vanenge vasina enough immunity, which means that if you take the first dose, you know your immunity in terms of effectiveness might be like 30%. But once you take the second dose, then, you know, I'm talking about my vaccines like when Pfizer, it goes up to 94%. And that's true for any of these other vaccines, more than one shot. It's like a booster. The second shot is a booster, but you're starting off from a low percentage in terms of immunity. So as we know, my vaccines, like Johnson & Johnson, their percentage effectiveness is around 66%. But Kuno, the regulatory body, FDA, they say anything above 50% is reasonable. So now if you just take one shot and you're around 20-25%, that's not good enough. It means that you are still at increased risk of getting the virus and potentially spreading it to other people. So I would encourage people who have received, if you're going to be vaccinated, do it fully. I would encourage everybody to get vaccinated.
Maybe let me ask that in English as well, that what's the importance of taking both doses if you have decided to take a dose, the COVID-19 vaccine that has 2 doses? Because some people have been reportedly just getting 1 dose and forget about it. What's the importance of completing your both your shots?
Sure. Thank you. It means that if you take only 1 shot and you're supposed to take 2, you are partially protected, which means that if 2 doses give you like 94% effectiveness, 90%, you take only 1, you are probably around 25-30%, which means that your risk for getting COVID-19 is still pretty high. So the FDA and other bodies here, they recommend vaccines to be effective, anything above 50%. So if you're sitting around 25%, you're not doing yourself a favor. So I would encourage everybody to get vaccinated. It's like you start antibiotics, right? And you're supposed to take them for 7 days, and you say, I took them for 3 days, I should be good enough. It means that you still are not adequately protected. So I would encourage everybody to get the second dose, get it completed. That's how you protect yourself and the people around you.
Now, Tutaranga, there's another issue here concerning these vaccines.
Sure.
Why are African governments, including Zimbabwe, not conducting any kind of research on these vaccines and coming out with, let's say, a Zoom vaccine? Maybe we may have that kind of a thing. What's the hurdle, really?
Well, people talk about the free rider problem, right? So unfortunately, for a long time, African governments and other governments in other parts of the world, they have relied on the Western world, particularly, of course, we know countries like China and Russia now, and India, they do a lot of vaccine production. But I think for a lot of African governments, we have to rely on these partners, whether we are buying the vaccines. But some governments like South Africa, I know that there was some research which was being conducted by companies like Johnson and Johnson, and South Africa kind of participated. I think that's a reasonable start. I think to have all the equipment, the necessary infrastructure to be doing research for vaccines will take a lot of time. This is developed over decades. So it can happen overnight, but at the same time, we shouldn't have a situation where people say, I don't want my people participating in research, but when the vaccine comes out, I want to take it. Now we still have to see how well it works for our population. So that also a factor that these governments have to be thinking about long term. How do we do it locally or regionally? You can form like, SADC and things like that. But, those things seem theoretical. They have to look at their priorities.
Some of the critics are saying that, the problem is that maybe we are too theoretical in our learning. At the end of the day, that becomes a problem. Can that be a problem, really?
I think it's kind of a problem, but it's, you put your money where your mouth is, right? So you may teach medical students, very well educated laboratory scientists and so forth. But for them to come up with these researches, they need support from the government. So we know that here we have the National Institute of Health. They sponsor a lot of these researches across the country in different universities. So that should be something that as Zimbabweans, Africans, we ought to be doing. If you do it consistently over time, it won't be as expensive as trying to do everything overnight. But that has to be part of our I would say policy, health policy. How do
Mhm.
we encourage research for things like malaria and so forth in our universities? The government has to take an initiative because, as you know, health is a public good. You know, these private companies will not do it if they don't think they'll make enough money. So
Mhm.
the government has to be willing to underwrite some of that research.
Yeah, because right now many of these companies are making huge sums of money through these vaccines.
Absolutely. And,
That's a
you
big
know, by
industry.
the
Yeah.
way, you know, governments like here, the USA government, UK government, they pumped billions of dollars. Of
Mhm.
course, they give the companies the money so that they do the research. And then the companies come up with the drugs, they have patents and so forth. They then sell them across the world. We should be doing the same in Zimbabwe.
Mhm. Mhm.
zvii
Marvelous.
zvakuti imi zvamadzidza iko kuno kuamerica pabasa renyu sachiremba zvingabatsirawo zimbabwe pari zvino panyaya iyo yedenda recovid-19 uyezve kuti tisaone chirwere ichi chiramba chichipararira munyika.
Zvatadzidza Marvelous ndezvekuti science should be what's leading actions anoitwa pasi rese whether ndekunoku. We know last year there was a lot of confusion nenyaya yema-face masks, nenyaya ye-social distances pakaitwa ma-rallies and so forth. Unfortunately, virus respect any political persuasion or kuti how high up somebody is. It's just a virus. And the way we manage it is the same. Based on what we know so far. Of course, we keep learning, and you don't stop learning. So what I would say in this, just use my templates but you can't do that without explaining to the population what you're doing and thinking, because the population is part of the solution. It can't just be tomorrow you wake up or we think we should do this. There's no explanation. People are upset. They still have to feed their families. So it has to be a collaborative effort, involve my scientists, my health professionals, the general population, the government.
Thank you very much, Dr. Ranga. Can you stay on the line? We're coming back to you very shortly. Let's turn to Mr. Musan Mosontin. So, Mr. Ntini, looking at what is going on in Zimbabwe right now, do you think that at the end of the day, this could be a solution to this bigger problem that the country is having in terms of containing COVID-19?
Are we talking about research or?
No, the basic thing of having these lockdowns,
Oh yeah. No, the lockdowns I think would not work on their own, especially when we know obviously they are not total shutdowns. When you look at countries like Canada, where they have had a lot of lockdowns, they were total shutdowns, where restaurants, bars, were totally shut down. But if you're going to say you're only reducing the operating hours from 8 to 5, that doesn't mean that people won't be moving around. If you have to do a lockdown, it has to be a complete shutdown, not to say you can only move around during this hour, because COVID has no hours, where it spreads during the day or at night. As long as people are mingling, they are meeting, it doesn't matter. It has to be a totally shut down if you want the lockdown to actually work. And also, just having a lockdown on its own would never work. We need to speed up the inoculation process. We should be talking about 35, 40%, or even more people currently inoculated at this point. But if we are still at 4%, we are just looking up in the sky and praying to God that this thing will go away. We are trying to wish COVID away. We don't have a plan to actually have enough vaccine so that people can be protected. Mina umbono wami ngibona ngani ama-lockdown emazweni asebenza khona aba ngama-lockdown lapho kuvalwa khona yonke into. Abantu isikhathi eside ukuthi hhayi sizaba le-lockdown for the next 2 weeks, sizavala amabhasi, sizavala ama-restaurant, only essential workers azahamba. Abantu bekwanisa ukuthi bethole ukudla ezindlini zabo, behlale endlini bengaphumi for isikhathi esithize. Lokhu kuyanceda ukuthi i-COVID ingaspread, ingahambi kakhulu. But I think ama-measures akhona eZimbabwe ba-reduce ama-hours ukuthi abantu bengaphuma nini. But i-COVID iyabe ikhona, akutsho ukuthi i-COVID ayikho. Ikakhulu nxa sifuna indaba yamabhasi ukuthi abantu bengaze bahambe edorobheni owe-1 hour. Sebebuyela ezindlini bazagcwala emabhasini bephana i-COVID. So ngombono wami ngibona ngani into eqakathekileyo ukuthi abantu bephiwe ama-vaccine. Ama-vaccine yiyo azanceda ukuthi umuntu ngitsho me-expose ngasoze agule okokuthi aye esibhedlela, uzaba nje lo ngama-mild symptoms, but kungalidi ukuthi umuntu afe kumbe ayefika esibhedlela. Ngoba i-COVID yona ngokwayo aso life sentence. Having COVID doesn't mean that you have to die.
Yes.
Abantu kabathola ama-vaccine bebe protected.
Yes, siyakuzwa kakhulu ke. Ngamafutshane baba Mlalazi, singakayi kubaba uRanga, udokotela. Ngamafutshane baba Mlalazi ungathini xa ungavala khonapho ke ngawakho amazwi?
Ngibonge futhi baba Mthethwa. Engifuna ukubonga nje into ekhulunywa inyanga yethu enkulu udokotela wethu lapho. Ukuthi i-COVID-19 you can only get it from someone else. I know it's a airborne disease, but being in a congested place, it's a super spreader on its own. That's according to his words, my doctor there. So then into engayitsho eyodwa babadube ukuthi into important according to my understanding and a key it's the information. People given information is not going to be helpful for sending a vaccine to people who have information, because as a doctor or as someone like Baba or they understand. But remember, there's a level of understanding amongst our communities. People they become abantu beliefs. So abantu, if they get proper information and get educated about these vaccines and what it does to people and its effectiveness, if my board says the words abantu they don't know, it's a new thing, and once they are being told about there's not enough research done to these people, it's going to be given to people, and they're coming from countries that they don't trust. If the moment you start mentioning how Canada, USA, China, about what they become suspicious. So if you live in a country like my Western world, you will understand that maybe it's not going to affect you. But remember, someone who's deep down in Zimbabwe, and all they know is these people that are coming to destroy us. They only think that these people that are coming to the second time to destroy us. So I think, again, using proper languages to the communities, like where I come from, I want to they speak Kalang. So a radio like this Studio 7, it goes to them, but they miss a lot from vital information coming from health professionals like our doctor in America. If you look at how loaded the doctor is, but then that information will have a barrier. People will not understand. So I think it's best if maybe in a situation, a pandemic situation like this one, prioritize this place, these situations more than political areas. So I'll thank you for that. That's my contribution.
Thank you very much. And marvelous, maybe the doctor, his last word. Just one minute.
Muchitudza mazwi enyekupedzisira Dr. Rangatozoza kuti manga mati muri kuuya pano kwenguva shoma uyezve muda kudzokera kubasa, asi tinotenda kuti manga muri pachirongwa chedu. Mazwi ekupedzisira ekungodzidzisa vanhu nokuramba muchivayeuchidza kukosha kwakaita kutora nhomba iyoyi yeCovid-19 uyezve kuteedzera zviga zvakatarwa neWorld Health Organization.
15 seconds.
Sure. Thank you for having me on the program. Chandingataura ndechekuti ngatiteedzerei measures aya social distancing, avoiding crowds, basic hygiene, kupfeka face mask. If we don't have to travel, don't travel. And we should ask the government kuti vatipe adequate information so that we can then make informed decisions. Thank you.
Thank you very much, Dr. Ranga. On that note, we wish to thank our guests this evening. Dr. Simbiso Ranga, he is here in USA. We also wish to thank Mr. Skumbuzo Mlalazi, who is a health worker and an independent social commentator, and Mr. Musani Mbusontini, who is also an independent social commentator. Signing off from Redland, this is Kim Chube saying, good night, Zimbabwe.
Ininzi ni marvelous mhlanganya huye nchiti muve nezuva rakanaka tosangana pa Let's Talk ngati kuri mangwana.
Good night.